Hello, I'm Dr. Rita, and I'm one of the doctors here for today. And you must be Mr. John Watson, right?
Yes, I am.
Okay. Well, I got to know that you have been recently troubled with pain in your shoulder and some pain in the neck. So could you tell me a bit more about that?
Yes, doctor. This pain started since about years, but recently, in the last 4 weeks, it become more severe. Okay, and start to affect my neck as well.
Okay.
I have a very mild pain before, but recently this pain became very severe and start affecting my life.
Okay. I'm really sorry to hear that, Mr. John Watson. I'd like to mention before we continue further that during our conversation, I might write down a few points, but this will be very confidential. And, okay. So to begin with, that you had this pain for years, both the pain in the neck and your shoulder, both of them?
Yes, it is in the shoulder and recently in my neck.
Oh, recently, the neck pain is of recent onset for the 4 weeks, right?
Yeah.
Okay. So can you turn around or can you bend forward? Can you bend the neck?
Anything of this movement increase the pain.
Okay. And do you have any fever with it? Any high temperature?
High temperature? Sometimes I had some feeling of shivering, and I feel that my temperature is high sometimes.
And have you taken down your temperature at home?
The temperature, I checked it. It was about one time it was 38.1, and one time it was 37.8.
Okay. And apart from this, do you have any burning sensation in your eyes when you're exposed to light?
No.
No. Okay. And the pain in your shoulder, is it also increased? It's also increased for the last 4 weeks, right? So can you move your arms around?
I can move it, but there is pain.
Okay. Can you lift up your arm? When is it more painful? When is it more painful? When is it more painful? I mean, during movement, or is it the pain is there all the time?
Both, doctor. Both. Sometimes the pain coming while I put in my arm and the wrist. Okay, and sometimes this pain can increase during wrist. But after a while of rest, I have this pain and I feel this pain. But also when I move my shoulder, anytime I feel the pain.
Okay. And so what is it? What do you do to relieve your pain?
I'm trying to take some painkillers.
And
sometimes, to some extent, the pain come back.
Okay. Right. So do you have pain anywhere else in any of the joints of your body?
Yes, doctor. Sometimes, other than my shoulder and my pain, I have some pain sometimes in my in the area of this pelvis, and I feel some pain sometimes in my knees. But mainly the pain in the shoulder is my main concern.
Okay. So is it both the shoulder?
Yes, it is. It is in both shoulders.
Okay. So can you pick up things with your hands? I mean, is it difficult? Or can you pick up things with your hand?
Yes, I can.
Okay. And can you comb your hair?
Comb my hair? Yes, I can comb my hair. But I have some pain.
Just to have some pain. Okay. And regarding your hip pain, is it also for the past 4 weeks?
The hip pain?
Yeah.
There is. It is not that much severe. I'm not sure about the details of this pain, but sometimes I'm feeling pain here and there.
Okay. So can you manage stairs? Can you climb stairs?
Yeah, I'm climbing the stairs.
Okay. So you also have some neck pain. Is your knee swollen as well? Is your knee swollen with the pain?
Swollen, no.
Is it which knee is it? Right or left?
Both knees as well.
Both knees. Okay. And this is also for 4 weeks?
For what? For 4 weeks? Sometimes it's a mild pain coming through the year. It was over the year. Yeah.
Okay. If I ask you to score the pain from 1 to 10, taking 1 to be minimum and 10 maximum, where would you put it?
Yeah. The severity, when it's very severe, it's about 6. But sometimes, usually I have the 2. All the time I have 2 to 4. All the time. But when it's severe during the morning, it is about 6.
Morning 6. Okay. And does the pain goes anywhere else?
This, as I told you, I feel it in different areas.
Okay. So apart from the pain, do you have any pain in your muscles?
Pain in my muscles?
Yeah.
You mean when I touch my muscles? This is what you mean?
When you touch them.
I feel my muscle hurts generally, but not when I'm pressing it. But I feel that like there is a general fatigue around my shoulders.
Okay. Yeah. So okay. So about the fever, you have documented it to be high temperature. You have documented it to be 38 and 37, right?
It was 38.1 and 37.6.
Okay. And so do you how's your appetite?
My appetite is a little bit less than usual.
Okay. And have you noticed any change in your weight?
In weight, yes, I have some weight loss, doctor, and I told that to my GB.
Okay. And you said some. Have you? Okay, right. So do you feel fatigue?
Fatigue?
Yeah.
There is some fatigue. I'm old man.
Okay. Is there lumps and bumps in your body?
Lumps and bumps?
Yeah.
No.
Have you noticed any change in your complexion lately?
That's what?
Any change in your complexion, getting paler or?
No. I don't think I did. I'm the same.
Do you have headache?
Headache?
Yeah.
Mild headache, not all the time. Sometimes I have headache.
Okay. And this also new for the past 4 weeks?
The headache?
Yeah.
No, I had a headache by the end of the day since a long time. A lot of stresses, but you know.
Okay. Right. So do you have any pain in your hands, the joints of your hands?
My hands, not really, doctor. Sometimes very mild pain, but not really.
Okay. Any changes in your nail?
In my nails, no.
Okay. Any soreness in your mouth?
No.
Okay. So how is all this affecting you at the moment?
All what?
How is all this affecting your life at the moment?
Affecting my life?
Yeah.
Yes, it's very bad impact on my life, doctor. I'm helping my wife alone, and I feel very tired of that. And I don't know what to do with that. I can't even do my daily activity. I can't take care of myself or my wife.
Okay, so you need to look after your wife as well? I'm sorry, but is she ill?
She's ill? No, she's not.
No, is she in good health?
Yes, she is.
Okay, so have you ever been diagnosed with any other illness before?
Yes, doctor. I have a cancer before. I think my GB told you that I have
cancer skin. So how was it treated and when was that? When was it?
It was 7 years ago, and I had a surgery for that.
Okay, and were you on follow-up after that?
Yes, I'm following with my dermatologist and my surgeon.
Okay. And were you declared cured at that time?
Yeah, they told me that I'm fine now because they did surgery called Mohs operation. And at the time, they told me that they have a clear itch, and I followed them, and my doctor reassured me that I would be fine.
Okay, right. So, do you have any? You don't have any headache? Do you have any dizziness?
Dizziness, no.
Any disturbance in your vision?
No.
Okay. And does the neck pain comes down to your finger? Does it comes run down your hand like a shooting pain?
No, doctor.
No. Okay. Do you have any chest pain?
Chest pain, no, doctor.
Okay. Any tummy pain?
No.
Okay. So how's the water work?
That's fine.
Okay. And your bowel habit?
I think it's okay, as usual.
Okay. So apart from the condition you just told me, the cancer you had, which was treated, do you have any other non-medical illness?
No, doctor. This is what I have now. Usually, I had hypertension here, for which I'm taking some medicine, and I have a high fat in my body, for which I'm taking some medicine also.
Okay. And do you have any high blood sugar?
No, doctor.
Okay. And so what was your last blood pressure reading?
Blood pressure. The doctor told me it is within the normal limits now.
Normal. And how many medication are you taking for it?
Only one.
Okay. Can you name it when you recall it?
Ramipril, 10 milligram.
Right. Okay. And
2 minutes remaining.
okay. So what's your concern?
Yeah, doctor. I'm worried about what's going on. Is it cancer again? Because I read on the internet that weight loss may be cancer, especially with this general fatigue and feeling and some fever. I am worried about a recurrence of my cancer. And my other question that should I take something? Is it related to you have something to give me in order to cope with my life?
Okay, I'm definitely gonna answer that. Just I'm gonna ask a few more questions. Do you smoke?
Yes, I'm smoking 10 cigarettes a day.
And okay, for how long?
For 30 years.
Okay, this may not have in relationship with the current situation you're having, but it might impact your health. So if you consider about quitting, we can refer you to our smoking cessation clinic. So do you drink?
Thank you. I'm drinking the weakness.
Okay, and right. So well, you were asking about cancer. Do you have any weakness in your body?
Weakness?
Yeah.
No. Same all the symptoms that I told you. This is what.
Yeah, right. Well, it's not cancer. What I'm suspecting after talking to you is that well, you might have some a number of conditions that affect your shoulder and neck, but I think these are some age-related issues, age-related changes in your joints, which is affecting, which is leading to this condition. And we will run some tests, scan some blood work, definitely to rule out any serious condition first, and then we will refer you to our joint specialist.
This is very good news, doctor. This is not cancer. You really relieve my stress. I'm very happy.
Well, we need to ensure that. For that, we'll run the test to make sure that these are not cancer, and we will refer you to our joint specialist. And for the pain, in the meanwhile, for the pain, we will give you some analgesics with some painkiller, and we'll also do some exercises to help with your symptoms.
Okay, doctor.
So, is there anything else you'd like to ask?
No, doctor.
No. Apart from the antihypertensive, are you on any medication?
But I'm taking Lipitor for 20 for my blood level, and I'm taking the Ramipril, and I'm taking vitamin D.
Vitamin D. And why are you taking this vitamin?
The doctor told me this is good for your bone.
Okay, for how long are you taking this?
Time finished. Thank you. So now you have 1 minute to collect your thoughts. In the real exam, there is 1 minute to collect your things, okay? But here to save time, we will start asking. Okay, here's the Rita. Yeah. So now I'll give you 5 minutes for the exam. Okay, what's your differential diagnosis, doctor, for this case?
The patient has bilateral shoulder pain as well as hip pain. It could be a case of polymyalgia rheumatica, but he doesn't polymyalgia rheumatica, but he doesn't give a history of any proximal myopathy. So that is something against it. And he
so proximal myopathy is a part of polymyalgia rheumatica. There should be a weakness.
No, sorry. There should be pain and stiffness. No weakness.
Okay. Do you ask about stiffness in this patient?
No, I didn't.
What else, doctor? What could be the other diagnosis?
And well, he complains of morning pain. No. But he asked about the duration for jamming. It can be ankylosis, any spondyloarthritis.
It could be ankylosis.
Spondyloarthritis, spondyloarthritis. Okay. Or it could be osteoarthritis.
It could be osteoarthritis. Okay. What else? Do you have any concern about his history of cancer and the long smoking history and weight loss?
Well, he was cured. Yes. He's also carcinoma usually doesn't metastasize, and he doesn't have any specific feature of neck meningitis. So
having one cancer does not increase the incidence of the presence of another cancer?
Yeah, it can.
Okay. What are you
doing? I will do some tests, which will include I will do a complete background looking test to check for any anemia and inflammatory markers like PSA and CRP, and autoimmune serology, including HLD27. And then I will do an X-ray of the neck and the hip. And if it is not suggested, then I will go for a CT scan. And some other routine tests like renal function tests and function tests.
Okay. Do you have any concern about being on statin?
Statin can cause myopathy. He doesn't have any myopathy.
Okay. What other causes can cause such symptoms? Do you think compression of the cervical vertebrae can cause that?
Yeah, but he doesn't have any radicular pain. Cervical myopathy due to osteoarthritis can happen, but we doesn't have any radicular pain. The pain is in both the shoulder and both the hip as well, and more in the morning.
Okay. If I told you to choose one image and one imaging with you and to make one blood work, okay, what would you choose to do for this patient?
I would choose MRI.
Okay, this is the imaging. What about the blood work?
Inflammatory markers.
Okay, including what?
ESR and CRP.
Great. Okay. Thank you, doctor. Thank you. So now, doctors in the chat box, I will come back to you, Dr. Rita. Stay there. Please, for other doctors, I want all of you to write in the chat box. I will be the only one who see the answers. Everyone give me only one diagnosis now. Dr. Dad of Selina and Dr. Jihad, you said the sound is clear around 150. So I think if a sound problem should be in your, in your computer or your phone. So I have statin-induced myopathy, polymyalgia rheumatica, myositis, polymyalgia rheumatica, osteoarthritis, osteoporosis, polymyositis, paraneoplastic syndrome, polymyositis, What else? Go ahead, doctor. Pseudo-gap, dermatomyositis, multiple myeloma, frozen shoulder, hand paraneoplastic. Okay. Okay, doctor. Great. Polymyositis, recurrence of cancer. Dr. Hussain gave me 4 diagnoses: polymyalgia rheumatica, polymyositis, dermatomyositis. Okay, and then in the presence of weight loss, I have to exclude malignancy, especially bronchogenic carcinoma. I agree. Okay, polymyalgia rheumatica, fibromyalgia. Yes, okay, thank you, doctor. I agree. This is all great logic diagnosis. Dr. Rita, let me go through your performance. You did well. You have a good confidence. The way you are talking to the patient is good, and this is very important because, as I said, for all the candidates attending with me, your self-confidence and to show that you are used to deal with patients, to talk with them, to speak with them, have a very big impact on your mark in the exam, because they care a lot to feel that you see patients usually. So I felt that usually when I feel that this candidate or this doctor see more patients, I feel that from the confidence you are following them. Okay, so I like your personal performance in talking to the patient. I like your introduction and be nice with the patient and ask him to write some notes. Okay, then you go through the analysis of the pain, and here I have some points that I will discuss with all of you, how to go through pain in the shoulder or in the back or on any joint pain. There is an approach to ask the question, and as usual, my main concern in any questions, I'm asking for the patient to get an answer that can help me to get the diagnosis. It's not only asking, so there should be a sequence. I mean, without a sequence in asking the questions, without algorithm, you will be lost in between. Maybe you will catch the diagnosis by luck, okay, but you should be organized. Here I feel, Dr. Rita, you are bringing questions from West and East, okay, so I need the questions to be organized in order not to miss anything. I want your thinking to be organized to catch the diagnosis early, and as well you can proceed as appropriate in the case. Okay, here you have everything went okay, but it was not, again, not organized way of asking. You didn't make you didn't ask the details about the treatment of the patient, the drug history, because the importance of the statin in this case. You didn't ask the family history. You didn't press on the social history. In this case, your main concern should be about the cancer, because any other diagnosis will not be that serious as a recurrence of cancer. With a previous cancer, with history of smoking for 30 years, okay, you should consider, okay, you should consider the presence of cancer. You should try to exclude it very early, because it is your concern before it is the concern of the patient. Okay, usually, as I said, anything in MRCP, you should exclude HIV. You should exclude HIV in anything, any case, whatever was the case. You should ask the questions of HIV, okay, about sharing needles, about blood transfusion, about unprotected casual relations. You should ask these questions in recent surgeries. You should exclude HIV for anything. And then the travel history, you can't just give up and ask this question. I mean, this is part of structure. So sometimes in some cases, the travel history is super important. One point I want to add, Dr. Rita, never answer the concern by a question. I mean, here I see most of the candidates doing that, and this is very annoying for the examiners. Don't ask the patient about his concern. He asked you a question, doctor, I'm worried if it's a cancer. So your answer will be, okay, I'm going to ask you some more questions. Okay, when you are asked about the concern, you should give an answer, then go ahead and ask what you want. You got my point? So this patient asking you, is it cancer, doctor? What will you give me? So regarding the answer of, is it cancer, doctor? You will tell him, okay, we need to exclude cancer. You have a history of cancer before, and with long history of smoking, we should consider to exclude cancer first. Okay, actually, it is not on the top of my list. I will not say it is in the bottom, because it is not in the bottom. It's not on the top of my list, but we still need to exclude it because your past history of the previous cancer and the smoking history. Okay, and you asked me, so go to the next concern. And regarding giving you something to help you, we will give you some painkillers to control your pain, and with working with the management team, including me, and you can mention including me and the joint doctor. Okay, and even if you want to say the skin doctor, we will all work to give you the best treatment and management plan that can help controlling your symptoms. Okay, that's how to solve the concern. That's how to get a full mark in answering the concern. So he asked the questions and you gave answers. Okay, but he asked a question, then you ask a question, then you will miss the concern. Okay. So remember, don't answer the concern by another question. Okay, agree, Dr. Rita? Okay, so now let me go to this case. In this case, then I will go to the algorithm. Okay, in this case, this was a case of polymyalgia rheumatica. Okay, what is the criteria of the pain on polymyalgia rheumatica, and what are the details of that we will discuss. Okay, but what we should exclude in this case will be the presence of cervical myelopathy. Okay, the presence of myositis, dermatomyositis, and polymyositis, fibromyalgia. You need to ask about trauma, although it's bilateral, but you need to ask about neck traumas, any history of neck trauma, and cancer, and as usual, the seropositive causes like rheumatoid arthritis, and we will go through that. Okay, actually, in this case, in the exam, this case came in Barnet Hospital 2017, because there's not the same, not identical case in Ryder. Okay, but this case came, and they make it more easy by giving you 60 or 65. ESR was 60 or 65, and here he wants you to know the difference between the polymyalgia rheumatica and the cancer here with the weight loss and with these symptoms. Okay, so you need to exclude this differential. You need to exclude multiple myeloma in that age as well. Okay, so this could be your differential when you're asking what's the differential in this case. Hypothyroidism should be excluded in this case. And remember something I want you to write: the thyroid function test should be a part of your workup for the shoulder pain cases, and it causes myalgia. And the weird thing that it causes elevated creatinine kinase. Okay, so sometimes you feel mildly elevated CK, like what you see in dermatomyositis and polymyositis with hypothyroidism. So there's no problem to ask here about any weather preference, constipation. Okay, but with the presence of weight loss, this will be unlikely in this case. Okay, so this is about this case. It's polymyalgia rheumatica, and the examiner expecting that you are going to exclude the cancer. Okay, because of the history of the patient, and you need to exclude polymyositis and dermatomyositis and fibromyalgia. And I like all the differentials you gave on the chat box. Okay, the most important part after this case is going through the algorithm. Okay, because this is one case, there is 50 possibilities to come in the exam for the shoulder pain. So you need to have an approach to deal with the shoulder pain. So whenever you have a shoulder pain, you should start by asking about any stiffness or laxity. Okay, any stiffness or laxity. I want you to write down what I'm saying, because I will add something. Okay, so any stiffness or laxity, and if you miss the question about the laxity, you may miss all the case. Okay, because some cases will depend only on this case to diagnose it, and we will see in the coming discussion. Okay, then does it increase by rest or effort? I don't want you to ask this question that way. I mean, you will not get the answer when you ask, is it increase when you take rest or decrease during effort? Okay, you can ask it by, do you feel it while you are at home sitting at rest, or you feel it's better while you are working? Okay, is it more after doing some efforts, or it improve with doing the efforts? Okay, so try to make the question not increase by rest, decrease by rest. It is not that way. The question will be, by is it during sitting at home in the off days, or is it with working and using your arms, for example? Okay. The other important question about other joints, and Dr. Rita asked these questions, and whenever it is other joints, you need to ask what's called PND, 3S, and rash. You need to know that by heart. Again, you will implement the same for the knee pain in some parts, and you'll implement the same for the back pain and hand pain in some parts. So you need to study this part of the algorithm so we can implement on the other algorithms. When if you attend our course, you'll see that we discuss cases for hand pain, back pain, knee pain, and there's some difference in the algorithm, but this is one of the shared thing in the algorithm. Okay. So for the other joints, you need to ask any affected joints, other joints affected. So for the PND, it is Socrates. Okay, so Socrates, as you know, we asked about the details of the pain. Socrates is the site of the pain, okay, and the onset of the pain, and the course of the pain, and the radiation of the pain, and the alleviating factor for the pain, and the timing of the pain, and the alleviating factors that help the pain, and the severity of the pain. So this is the Socrates. Socrates, again, you ask it for the pain, then the N for the numbers of the affected joints. So the P for the pain, here you will ask, you write Socrates. Then for the N, the numbers of the other affected joints. Then the D for deformities. Does the joints that is affected deform it? Okay. Then you ask 3 S's. The first S is presence of swelling. The next S is symmetry. The third S is stiffness. So again, every question I'm going to ask is not only to show that I'm asking the question. Every question I'm asking will give me an answer that will help me to reach the diagnosis, and they will show you how. Okay. So please, doctors, write on the wall, because it appears to me I don't know how to stop that. But anyway, don't write on the wall. So here the other joints: pain, number, deformity. Then the 3S is for the swelling, for the symmetry, and for the stiffness. And then you ask about any rash. Please, you shouldn't miss anything of these questions. Okay. So you ask these questions. Then what the answer of these questions will mean to me. Okay. If the answers are yes, there is a laxity, and here I mean by the question of laxity, the hyperextensible joints. Okay, and the presence of hyperextensible joints is a cause of the pain. Okay, so the patient who can hyperextend his fingers, his shoulders, his arms, when he has these 3 conditions, which is Ehlers-Danlos syndrome and pseudoxanthoma elasticum and Marfan syndrome, and you can add osteogenesis imperfecta as well. Okay, the patient